The third big seismic shift they talk about is this move from sickness to a prevention model. And to me, I think that is very welcome, because I've always talked about the need to move from this pathogenesis model that we are taught in our medical schools to the model of salutogenesis, where we need to be creating an ecosystem for health to flourish and to actually thrive, rather than to just think of a drug to be taken to just manage a condition. This provides the perfect opportunity for a lifestyle medicine first and a targeted trauma-informed approach to pain management. And I think the role of a variety of things that comes under this banner of prevention is going to be very useful. First of all, the focus on reducing obesity, creating or incentivizing supermarkets and various organizations to ensure that eating habits are optimized can be really powerful, even in the role of pain management. As you know, I'm a big fan of using nutritional strategies as a technique for immunomodulation, especially for nociplastic pain. So I think there is a huge opportunity to jump on this bandwagon of prevention models for reducing obesity, for expanding the mental health support that's been talked about, for actually working on improving sleep, nutrition, movement. All of these are actually the same pillars of lifestyle medicine that we talk about and that we know are causal drivers in chronic pain. So I think all of the elements that are being talked about in prevention can really be easily transferred to a more broader, holistic, integrative approach to pain management in the community as a form of prevention. So that's, I think, a fantastic opportunity for that. The other is this creation of a health reward scheme, which is an aim to sort of nudge various various organizations towards more pro-lifestyle approaches. And I think if that is all going to enable what I've already spoken about, then that's all going to be a way of offering reducing pain management strategies. So I think that's really great. And the last bit is around the role of what they call as young futures, is around improving school-based offer for mental health support, for physical activity, for sleep optimization. And I think there are organizations that are already starting to do this. So I think there is a huge opportunity for rolling out a bit of pain science education along with this into schools, at primary, through the PHSC curriculum and through sixth form. And I think this is a great opportunity. I have done some work already with schools in this space, and I know that this is hugely important and can be hugely impactful, because you are going after really young minds and you're giving them the right education at the right time, and that can have a lifetime of good advice which can change the trajectory of how pain is perceived, managed, manifested and treated in the future. So this is the opportunities I see with the 10-year Fit for the Future plan as you tailor it to pain management. And I'm very hopeful that there are opportunities here that we as healthcare professionals must really be aware of and work with our organizations and societies and local primary care networks and integrated care boards to see how we can present this compelling case for our patients. Now, are there challenges to this? Absolutely. I think two structural enablers that have been happening is the need for creating integrated neighborhood teams. And the second is for aligning financial incentives as a system to enable this. Firstly, the financial incentive piece I think is very critical, because right now we do not have satisfactory funding or recognition or even proper coding of chronic pain uniformly across the country or even in various primary care networks. So I think providing a financial incentive when they do so, if this can be done for chronic pain properly, will really align incentives in the right way and make this one of the priorities to be done. I think they talk about a year of care payments to be introduced by 2027, and I think that will really align perfectly with providing multimodal pain care pathways at the community level, which is crucial and critical in my view. The second is they're talking about bonus payments for high quality care and patient satisfaction. And that means that if we can have good quality pain services that are able to provide this integrative approach, then that is going to be improving patient satisfaction. It is going to be providing care closer to home quicker. And I think that is going to be a definite win-win. The second structural alteration is the creation of integrated neighborhood teams. I think that is a challenge because we right now haven't identified where the funding and how one creates an integrated neighborhood team. But from my view, the case studies that they have presented in the plan do show that where it's created, it is making a huge impact in the fields of mental health. So I think that there is definitely a role for trying this in our complex pain patients, which are again high need patients where such case studies have shown benefit. The hospital at home like features or case studies they present has saved almost more than £2,000 per episode apparently. And I would think that when patients have chronic pain flare-ups, we know that many frequent attenders in many emergency departments are often for chronic pain presentations into emergency care, low back pain or neck pain, repeated investigations, repeated scans, repeated blood tests are done every time. If we can introduce a neighborhood team that actually addresses this, then there is going to be huge financial savings per episode. So while there remains a barrier to creating a neighborhood team, I think the concept of a pain integrated neighborhood team is very exciting and appealing and more positive. Well, these are my insights and my positive outlook on the 10-year plan and whether it is fit for the future as far as pain management is concerned. I do think there are huge opportunities and I look forward to seeing how much of this becomes a reality over the next 1 or 2 years. So if you're finding this useful, go out and have a discussion with your commissioners, with your local partners to see how you can be part of this plan in discussing and making it a reality for our chronic pain patients. Thank you for watching this video and I look forward to seeing you in the next one. Thank you for watching this video. I hope you found it of value. So don't forget to like this video and subscribe to this channel and click on the bell button to be notified when the next video comes along.